Today we have this lecture about statically indeterminate mechanics, and we have to restart from the slide that you have already seen during the third webinar when we were talking about equilibrium. The reason why I'm showing this slide again is because it's strictly related to equilibrium and to the basic equation of statics, which are the laws of equilibrium of Isaac Newton. So when we were talking about the statically determined mechanics, that could be represented with this diagram, we have a wire which is engaged in this bracket and has a passive shape, which is this here, and we apply a force to make the wire reach the red bracket here. So we apply this force, the wire is deformed, it takes the activated shape and position, and with what we have here is that the only thing that we apply to the wire is a force. So the wire reaches the red bracket only by a force. Now, if we do not engage the wire inside the slot here, and we make a ligature here, the force is only transmitted through one point and stays as a force. So actually, if I measure with the force gauge the force of 100 grams, I know that the deactivation force that is applied to the red bracket is again 100 grams. And now, with the equation for equilibrium, and by knowing the interbracket distance, I can find the equilibrating force system, which is actually equivalent to the activation force. Now, this is very simple mathematics. I start with this 100 grams in one direction. I know that in the other side there will be the same quantity of force in the opposite direction plus a moment, which is the force times the distance, 1000 gram-millimeters. And please remark that the direction of the moment here is counterclockwise, while the two forces that are applied here and here create a couple which is clockwise. Okay, so this is what allows us to find out all forces and moments in statically determined mechanics. But when we work with statically indeterminate mechanics, things are different. What are statically indeterminate mechanics? Okay, here it is. I have the same wire. I apply the same activation force of 100 grams, which is this one. And once I'm here, I do something else. I bend the wire in this direction, this an activation moment, so that the wire, which is, as you see here, look at this, you see the wire has not the angulation of the slot. So I will bend the wire so that it becomes parallel to the slot, otherwise I cannot engage it inside here. Okay, so actually, in order to find out the whole force system, I will need to measure both the force and the moment. Actually, here, while I'm engaging the wire into the bracket, I will produce 2 points of contact, one here and one here between the wire and the bracket. And so I will produce, let me try to be as clear as possible, one force here and one force here, and these 2 forces are generating this moment. Well, there is an interesting thing, is that you will learn that once you modify the shape of this wire in order to engage the wire into the slot, automatically also the quantity of the force will be modified. And here you are in a condition where you only have a force gauge to measure the force you need to elevate the wire to this level, but you don't have an instrument to measure this moment. So the real problem is that when you work on the dental chair, you don't have the instruments to measure the force system that you apply. So you raise the wire here and then you bend it in order to engage it in the slot, but you don't know which is the force system. And so if you don't know the force system, because here I wrote to you, okay, what if we have this 500 gram millimeters, but this was just an example to let you calculate the equilibrating system. But actually in real life, this is not 500 gram millimeters, but it's a big question mark. And since this is a question mark, also this 100 gram force of activation is not actually what will be applied to the tooth. So the real thing is that once that you are engaging the wire into the bracket, you have no practical way to measure the force and the moment, and you don't know any of them. Since here you have a big incognitus here on the 2 sides, on this side, of course you cannot compute the force system on the other side. And that's why we call this system statically indeterminate. So the rule is, whenever a wire is engaged on one side and not engaged in the other side, we have a statically determinate. So you have a single point of contact, can be a hook, it can be a ligature. We know that. But whenever the wire is engaged on the other side, so we have an engagement here as well, then the system becomes statically indeterminate. In other ways, you cannot use this equation to find out everything. So this is the first step. And what is the difference between the 2 kind of force system? So here you see the multimedia online textbook Biomechanics in Orthodontics. We're going to use in order to make this lecture, and I'm going to show you something from chapter number 7, Statically Indeterminate Systems. And here we have the index of the chapters and all the pages, and I'm opening it here to show you some material. So Number one, we can open this animation here. And this is interesting to see how forces are generated inside the bracket. So we can see here that inside this bracket, this wire, which is engaged into the slot of this bracket, can produce a single moment, a force, and a moment, or a single force. Let's understand how this works. So single moment is when the wire, that I tell you again has 2 points of contact inside the slot, produces two forces which are of opposite direction and equal magnitude. In this way we form a couple, and the couple is equal to the amount of the force times the distance. So in this case we have 100 grams. If the distance is 3 millimeters, as shown here, we'll have a moment of 300 gram millimeters. So that's how a single moment is created. But if the forces are not of the same amount, and here I represent one force up of 150 grams and one force down of 100 grams, actually we have a moment and a couple, because we have the same we have a moment and a force, sorry, because we have the same moment that we had before, plus a residual force of 50 grams. So if the two forces are not equal, you will always get a force and a moment. There's also the possibility of getting forces with no moment if the 2 points of contacts are on the same side of the slot. So the two forces that might even not be equal are summed together to get a single force and no moment. So in this way you can get a force and no moment. In this way you can see the forces are vertical and moments are those that we call second order of tipping. Well, you can also produce buccolingual forces, and in this case the forces are produced against the button of the slot and the ligature system. So the same mechanism will show you a moment for rotation on the occlusal plane when you have two equal forces, or forces in the moment if the two forces are not equal. So this is the same equivalent force system, force plus moment, or these two forces. This is exactly the same. Or you can have a single force if the two forces are both to the ligature or both to the bottom of the slot, and so you can produce a single force. So these forces I've been showing now are buccolingual, and moments are of rotation. You can also produce in edgewise system mesiodistal forces, and they work like this. They are produced through friction rather than the way that we have seen now. So let's assume that we have these three brackets, and we have a wire which is engaged in these three brackets. Now the forces that we are producing are going to level the three brackets. There will be also moments, but I didn't show them here. So what is going to happen when these three brackets align? So there are two possibilities. One, there is a lot of friction and it's not possible to see any sliding of the wire with respect to the slot, and we'll see something like this. So the friction will move the two external brackets apart, and so this would be mesiodistal forces. If the wire is totally free to slide, this does not happen. We could see the alignment with the wire that is getting out of the space between the brackets. Actually, what happens during this alignment are periods where you have the possibility of sliding and some other moments where there is impossibility or a binding between the wire and the slot, and so it's very hard to find out exactly how much force is generated. But in any case, we know that during this alignment with large deflection, we do have mesothelial forces that can be also very, very important. So this is a concept that I wanted to tell you before introducing the main topic for today, which are the 6 geometries. As I said before, with laws of equilibrium, with the equation of equilibrium, we're not able to find out the force system, and for this reason we will have to use other concepts that were described years ago by Professor Charlie Burston. Well, in the year 1974, Burston and Koenig have published this paper, which is has the name of as the title of Force System from an Ideal Arch, describing the force system that is produced by a piece of straight wire engaged into two brackets. And here is also described the concept of geometries, which is very interesting and very important, and I'm going to describe this concept of geometries here. First of all, let me tell you how geometries are determined. So we have, in this case, two brackets, two teeth and two brackets, and we trace two lines that are representing the orientation of the two slots. These are the two dashed lines, and we trace a second line which is connecting the center of the two brackets. Now you see that there are two angles formed that we call theta A and theta B, and the ratio between the two angles is representing the geometry. So the geometry depends on the ratio between these two angles. So here we have an overall view of all geometries, and we have to remember that these are just special condition of the ratio between the two angles, but I would say that in the great majority of cases we have a ratio between the two angles which is not exactly corresponding to the 6 geometries, and we have conditions that are in the middle. And in these cases, we could talk of a situation which is in between geometry 1 and 2, or in between geometry 2 and 3. So now I'm going to describe the force system that are in different geometries. Here we have geometry 1. In geometry 1, we have two equal moments, and these two moments make so that we have the same ratio between the angles, which is 1, and the same ratio between the moments, which is 1. Since we have two moments that go in the same direction, we will have a sum of all moments, which is an x amount, and this means that we have two forces. We need to have two forces to equilibrate the system, otherwise the system is not in equilibrium. And you see that these two forces here are generating a moment which is clockwise and is equilibrating the sum of the two moments which are counterclockwise. Also keep an eye to this value. Key is around it's a value which gives us an idea of the rigidity of the system, and in geometry 3 is about 3000. This changes with geometry and the wire, but we will keep the same wire, so the only change you will see will depend on the geometry. So let's see this again. Geometry 1, it's when the two angles are equal, so it's characterized by the ratio between the two angles, which is 1. when you have this condition of geometry 1, you always have also this ratio between the moments. So also the ratio between the moments depends on the geometry. We have two equal moments on the two sides, and we have forces to equilibrate it. Okay? Now we pass to geometry 2. And in geometry 2, we have had a rotation of this bracket here, of this tooth here, so that this angle has been reduced. Now the ratio between the two angles is 0.5, and this means that we have also a reduction of the moment here. So what happens is that we have a ratio between the moments which is 0.8. So if this is 1, this is 0.08. And this it's also coupled with a situation where this moment is going down. So this moment is reduced, and this moment is reduced even more. But two moments are going in the same direction. So in geometry 2, the two moments are going in the same direction, and the two forces are still here because the sum of the two moments, it's still not zero. But as you understand, these two forces are reducing compared to what they were before. Now we go to geometry 3, and geometry 3 is a very special condition because we have no angulation here, so the rotation on this side has produced an angle of 0. In spite of the fact that we have no angle here in this bracket, we still have a moment. And actually, we don't have a ratio between the moments of 0, but a ratio of 0.5. Just means that the moment here is 50% of the moment here. Since the key value here is reduced, and it's about 2/3 of what was in geometry 1, this means that the moment here is also reduced. The sum of the two moments is reduced, and so are the forces. So again, geometry 3, the ratio between the angles is 0, the ratio between the moments is 0.5, the moments go always in the same direction, forces are reduced, and the rigidity is reduced compared to geometry 1 and geometry 2. Now we go to geometry 4. And in geometry 4, we have a special condition again. In geometry 4, we have this angle that is now opened in the opposite direction as this one. The ratio between the angles, it's 0.5. So what does it mean? This angle is not open in this direction as it was before, but now it's open in the opposite direction, and the amount of the angle is 50% of what we have in theta b. In this special condition, we have on this side no moment, but only a force. We call this the dissociation point, where there is a force and no moment on one side. The key value is reduced again, and it's about half of what it was in geometry 1. And forces are way lower because this moment here is half of what it was in geometry 1. This moment is not existing, as you see, and therefore forces are much lower. Now, what we see in geometry 4 and geometry 3 is actually not something that we can understand just by intuition. In geometry 3, again, we have no angle here, no angle. Here there is no angulation, but we have a moment. On the opposite, in geometry 4, we have an angulation here, but we have no moment. So why is this? So I have to show to you a couple of videos to explain you this. So here we are in geometry 3, and I've been drawing these two brackets here in a position corresponding to geometry 3. I use a wire. This interbracket distance is huge, but this is important so you see a large deflection and you see things better. And I hold the wire with the plier on one side, and I use an instrument to raise the wire on the other side. As you see, there is an inclination when the wire reaches the level of the bracket, which is not corresponding in the inclination of the wire to the inclination of the slot. So we have an angulation that it's existing between the wire and the slot. This inclination requires that I bend the wire in this direction, and this is reducing the moment. So in spite of the fact that we have no angulation here, I will have a moment because of this bending. In geometry 4, I can see a similar thing. And I've just changed the position of the bracket. Just change the position of the bracket so that we reproduce a geometry 4. Look that we have these two lines corresponding to the orientation of the slot, and these are intersecting at 1/3 of the interbracket distance. So in this condition of geometry 4, I do the same experiment as before. So I raise the wire on the other side, and you will see that when the wire reaches that bracket, the angulation of the wire is exactly the same as the orientation of the slot. So they are parallel, and we don't produce any force. We don't need any bending to engage the wire into the slot, and there is only a force. That's why in geometry 4 we have no moment. Okay, so here it's geometry 4. Now we have geometry 5, and in geometry 5 we have this bracket, this angle, which is opened in the opposite direction, and finally we have a moment which is oriented in the opposite direction as it was before. Please remark that both in go back to geometry 4, that in geometry 4 we are reducing the forces, of course, as I said, and we go on reducing forces in geometry 5. Now we have a moment which is in the opposite direction as we had in geometries in the previous geometry. The ratio between the brackets is minus 0.75. The ratio between the moment is minus 0.4. Again, what does it mean? That there's not a linear relation between these two values. And now in geometry 5, finally we have a moment which goes in the same direction of the angle. The forces, of course, are much reduced. Look at the key value. This means that we have a reduction of this moment as well. In geometry 6, finally, we have an angle which is opened in the opposite direction and has the same value of what we have in theta b. So again, I've been rotating this tooth, and now the bracket that in geometry 1 was here. By rotating in this direction, we went through all the geometries. So geometry 1 is here, here was geometry 3, and here I got finally to geometry 6. And this is the opposite angle. In this condition, we have two opposite moments of equal magnitude. Okay? Of course, there is no force because we have sum of all moments which is equal to 0. Now let's give a very quick look to the geometries in a sequence so that you have an idea of what is changing again. This will be very, very quick. I go back to geometry 1 from the beginning. So geometry 1, two equal angles and two equal moments. Maximum of value of the moment here, maximum of forces. Key is a maximum value. Go back to geometry 2. This moment is reducing more than this one, but also this one is reducing. Ratio between the angles is 0.5, ratio between the moments is 0.8. Forces are reducing. Forces are always reducing, going from geometry 1 to 6. Here we see that we have no angle in geometry 3. Here we see that the moment is 50% of this one. Okay? Remember that the moment on this side is always reducing. Okay? Going from geometry 6 to 1, from geometry 1 to 6. And this depends on the reduction of this value. The ratio is 0.5. And geometry 4, we have an angulation which is open in the opposite direction now, no moment. This moment is also reducing. The forces are reducing. This is geometry 5 with this angle which is still more open, and now we have a moment which goes in the opposite direction as this one, and very low forces. And finally, we have the geometry 6 with the two moments that are opposite and the two angles which are opposite, equal values both for the angles and the moments. Okay, so this is a very quick show of the 6 geometries. Look, in geometry 6 we have no force because the two moments are equal and opposite, and this system is already in equilibrium. So once you have seen a first presentation about what are the geometries, what are the force systems, the next step is that we are able to find out which is the geometry between two brackets. Now I have just taken this little drawing from our exercise book to give you an idea of how someone can have a judgment about the geometry. So the thing you have to see once you look at this very crooked teeth is that you have to focus on the two bracket system. So for example, I focus here and I try to see to visualize in my eyes the orientation of the two slots, or the two tubes in this case. And this will give to me the kind of geometry I find. So this condition here, I see that the two lines are crossing very close to one of the two, to the center of one of the two tubes. And this is a condition which I can define geometry 3. Okay. In geometry 3, we have one of the two brackets, one of the two angle which is something, and the other which is 0. Remember that in all geometries which are not symmetrical, so I don't consider geometry 1 and geometry 6, there's always one of the two angles which is larger than the other. And this angle is the angle where we have the crossing of these two lines. So if I have to define this condition, I would say, okay, we have a geometry 3, and this bracket is the one with the larger angle. Okay, this is the largest angle of the two. Now, so we have a condition of this kind. I will just represent it here. This is geometry 3, and this is what you have here. Okay. Lower geometries, and I will find some of them, are those geometries where there is no crossing. So we take this for low geometries example. So you see, you trace here and you trace here. The crossing will happen outside of the interbracket distance, so it's happening more or less this in this area. This means that we are below geometry 3. We could say, okay, this is a geometry 2 or something, but the important thing is that we have the idea that this bracket here is the bracket with the highest, the largest angle. Now we have, so this is geometry 3, this is what we call low geometry, and we have, we find another condition which is this here, where the crossing of the two lines, it's between the two brackets, so within the interbracket distance, and this is a high geometry. It's very difficult to say exactly what geometry is it. I mean, is it a geometry 6, 5, 4, or whatever? This depends on the position of the point where these two lines cross. And you can very well imagine that in the clinic, it's not really easy. It's not really easy to see, okay, this is exactly a geometry 4 with the crossing is here, or is it's a geometry 4 with the crossing at 1/3 and 2/3. So it's enough for me to have an idea that we have a high geometry. Nevertheless, maybe this is not perfectly symmetrical. I could assess this to be a geometry 5 or 4. But now you have an idea that we have high geometry when you see, now I will erasing everything. That you have a high geometry because we have a crossing in the interbracket distance. We have a low geometry because the crossing it's outside, or in geometry 1 doesn't exist. And geometry 3 is because the crossing happens just here, in corresponding to one of the two brackets. Now, once you have an idea of the geometry, you can say, you can have an idea of the direction of forces and moments. So we can do the same example. You can use the same diagram. I take this out. And so let's work on this 3 example. Here I say we have a geometry 3. I trace this again. And this means that we have, since we have the crossing here, this is the angle which is the largest of the two. Now take this side to understand the direction of the moment. So if this is the largest, we know that the moment I got here, I can find out as if this was a cantilever. So if I had a cantilever like this, and I have to activated in this direction, it means that I have a moment like this. Okay? So geometry 3 starting with this moment. In geometry 3, the moments go in the same direction. So this means that this is counterclockwise. Also here, I have a moment counterclockwise. Now, if I have this 2 moment counterclockwise, I also have forces because the sum of this moment is not equal to 0. And I will need to apply these 2 forces that produce a moment which is clockwise. Okay? So this is the force system generated here because this is geometry 3. Now we go to the other 2 geometries that we have seen before. Let's assume that this geometry here, we said it was geometry 2, with the largest of the 2 angles, which is here. There's no big difference with geometry 3 actually, because this is the largest of the two angles, and if you think to the cantilever activated in this direction, we have a moment which goes like this, and in geometry 2 the 2 moments are again in the same direction like this. Okay, so you need also forces to equilibrate the system. Now when you want to see the last one, you know that it's hard to say whether this is a geometry 4, geometry 6, maybe it's even hard for me by drawing this. And let's assume that this is a geometry 4. Okay. In this case, I'll try to draw it more exactly. Okay. So in this case, this it's very important because this is the angle which is the largest of the 2. And if this is geometry 4, remember, on the other side you have only 1 force. So this means that in this case we have a moment here, and we have no moment here, but we will need to have 2 forces, one like this and one like this. Okay, so look at these lines to find out the geometries, and then from the geometry you find out at least the direction of the moments. It's very complicated if you're not used to that, but it's important. It's very, very important when you have a condition like this. You try to you try to have an idea which are the geometries, and especially which are the high geometry and low geometries. So I will try to tell you very quickly which are the low geometries, because these are geometries that are, as I will tell you, are not very good. Most of the time, high geometries are better. So here we have a geometry 3, which is a borderline. This is a low geometry. This is a high, so write down low. This is a high geometry. This is low. This is low, but there is very little malalignment. This is low again. This is low again. This is high. This is high. This is low, 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 and low. So you see, in a case like this, there are a lot of low geometries, a few high geometries, and as I will explain to you, low geometries are source of inconsistency. So now I just want to show you what is the whole story. So this diagram tells you that there is a geometry for every couple of for every two bracket system. But one thing is important when you work with the continuous arch wire, that there are situation, of course, where there are two geometries acting on the same tube. For example, this tube here has a force system here and another force system here. This force system depends from the relation to this bracket, and this force system to the relation on this bracket. And this makes things very difficult because it's very hard to understand the movement in a continuous arch wire, even if you know geometries. Why is this? Look at this force system that we have here. In the force system I have at this level, I have a clockwise rotation. And on this force system I have a counterclockwise rotation. So the opposite, sorry, this is a counterclockwise rotation, this is a clockwise rotation. So I know the direction of the moment, I know that these are opposite, but I don't know the quantity. So the real problem is that I really don't know whether this molar is rotating in one direction or the opposite direction, because it will rotate in the direction of the largest of the two moments. But I don't know the amount, so I can't tell you. I only know that there will be a force in this direction, but that's not enough. So we have to be very careful. And in conditions like this one, what I'm saying is that if you just use a superelastic wire to be engaged in all the brackets, your capabilities of predicting the movement are very, very low. I mean, what you know is that at the end of the work of the alignment wire, the teeth will be aligned somehow, but you don't know exactly the forces that you have applied, the absolute position that teeth will have at the beginning, because it's very easy to say the teeth are, this is another story, but I was looking for something else, so with this we can take it out. It's very easy to say we have an alignment, but it's not easy to say exactly where there is this alignment. So I want to show you this concept, which is very important to me. So this is, oh sorry, Sims is not working. I was hoping it was working, but it is not. And I will have to draw something again to express this concept. So the idea is that if you have two brackets like this, what is the meaning of indiscriminate alignment that we always have in statically indeterminate mechanics? We know that the two brackets at the end of the work of the wire will be aligned, but we don't know whether we will have this alignment with this bracket that goes down here. We don't know whether this bracket is going up here. But most probably what will happen is that we will have a condition where there will be some rotation of this bracket, some rotation of this bracket, and the alignment will be something like this. So it's very hard to predict what will happen. There's a lot of options that are open, and this, as I have to discuss in a more high-level lecture, depends on the resistance to displacement on the two sides. But what I wanted to tell you is that if you work with a continuous arch wire, as we have done in this example before. It's really very, very hard to predict all the force systems, and even more to predict the movement of the teeth. You have actually some chances to have a prediction of the force system and of the movement if you work with the two bracket system. What does it mean? I know that it doesn't make sense for you right now, but in a condition like this, which is not very common, I mean, this is just a condition that I have imagined for this exercise. But many times you can imagine, for example, that you want to move this tooth by working with the wire which is kept passive here, and so we have a passive wire here, and do something in this area between these two brackets. Or maybe have a little wire that is working between these two brackets. So working with two bracket system is a solution to make things predictable, as we will see. Another important concept that we have to stress is that when we speak about geometries that are existing between these two brackets, we have to consider that we have a geometry on this plane which produces these vertical forces and this uprighting tipping moments. But we also have forces on the occlusal plane. So this force system that we see on the occlusal plane might also exist. And geometries that we have on one plane are completely independent on what we have on the other plane. So you might have a condition where you have a low geometry or a high geometry on one side, and you look at the teeth on the other side, on the occlusal plane, for example, and you see a completely different geometries. All these geometries do create forces and moments, and you have to understand how terribly complex is a system where we have a sequence of bracket like this. As I said, we have seen before the possibility of recognizing the geometries, and we have said that the only thing we can do is just to find out the direction of force, the moments that are generated in a two bracket system. Of course, theoretically, there is the possibility of finding out the amount of force, and this amount of force can be calculated if you use special formulas that you find here in the book as well. Here you can see the formula that will lead you to the MB, which is the moment on the largest of the two angles. So if we have this condition, for example, which is might be a geometry 4. Now the the largest of the two angles is this bracket here, and if I would like to know which is the amount of moment which is in this direction that is applied here, I have to multiply the value of key, and this will depend on the geometry and on the wire. So it's already tough to make a calculation of this. It's impossible to do it clinically. Times the angle that I got. So the angle is this one here. So just imagine you have this thing here. And divided by the interbracket distance. So it's understandable that no clinician can have an idea of this amount. That's why this is considered indeterminate. But we have to have an idea, for example, that the moments that I have here will be larger or smaller if we have a small or large interbracket distance. So in small interbracket distance, forces and moments are larger than if we have large interbracket distance. And for this reason, it's not a bad idea. For example, if I have this condition and this condition, it could be better just to skip one bracket and to use this two brackets system here with the larger interbracket distance. So keeping interbracket distance large will reduce everything. We will see this again. But of course, another factor influencing the amount of this moment is the amount of angulation. And again, is it impossible in the mouse to measure the angles? So all in all, we have the impossibility of measuring this moment, of even calculating this moment, unless we will find a completely different way. And anyway, going on with the mathematics with it, once that we had calculated the moment in the largest angle, which is this one, we could find the moment on the other side using this function, which is generating this curvature here. So, or you can use this chart. Once that you know the moment on one side, and once that you know the ratio between the angles, you can find the other moment. Again, it's so complicated that no one can really use the system to find out the amount of forces and moments that are generated by these two systems. So we have to accept the fact that when we use statically indeterminate mechanics, even if theoretically I could come here and make a lot of calculation and find out, but this is just a theoretical exercise. So we just know that in the practical we need to work with the only idea that we know the direction of force and moments if we are good, but we don't have an idea of the amount of them. For what concerns mesodistal forces, I have said to you that we have the possibility of generating mesodistal forces. This can be generated by friction, and I've already told you this. And mesodistal forces are there in statically indeterminate mechanics, and they have been studied by Burston and Koenig a few years later, so 15 years later than the first paper. And here you have an idea that these forces might be very, very, very large. So here you see, I'm not going to in the details of this chart, but if there is theoretically, if there is a total impossibility of sliding between the wire and the bracket, you might have forces in different geometries that are in the range of kilograms. So here you see in geometry 1 force, the mesodistal force is about 2 kilograms, and raise up to higher geometries to very, very large forces. The reason why we have larger forces in high geometries is because high geometries allow for larger deflection. I want to show you this image. Here we have a geometry, a high geometry, maybe a geometry 6 or close to it, both in the frontal view and in the occlusal view. So I'm drawing this. Here we have a high geometry because the crossing is more or less in the middle, and here we have a high geometry as well. It's hard to say that they are geometry 6, but anyway, they might be close to geometry 6. What am I expecting here? I'm expecting moments that are very nice because they make this two teeth straight. And these moments are also rotating in the right direction, the two incisors. Now let's think something. I mean, if we had the pure rotation of these teeth, this means that the center of rotation, which is here, somewhere here, is not moving, and the crown would go one against the other. It's true that they would go a little bit out if you see the geometries in the moment generated here, but in the overall, what happens is that I'm going to see here a movement which is not only given by, I'm just enlarging this, by the moments. And why is this? Because, as you will see, I'm even opening space here and I'm creating space here. Why is this? Because friction is acting here, and in spite of the fact that the wire gets out of the outer part, and you see that is accenting it here, but friction has expanded these two brackets and these two teeth. Here I see a little bit of space, and this depends on the fact that the wire needs to slide when we have large deflection, and if it does not slide, it will expand the distance between the brackets. So it creates mesiodistal forces. And it's a rather complex topic related with friction, so it's better that we leave it for now. And I would like to talk now about the limits that we have if we work with continuous arch wire and if we work with statically indeterminate mechanics. And this is very, very important by a clinical point of view. I mean, I hope that you have been following me until now, but now we are getting to the point that we are going to apply some of the knowledge that we had in the clinical part. A look at these two pictures. These two pictures were given to me by Professor Burston several years ago, and it was the time where very old pictures. It was the time where superelastic wire were introduced, and people were just enthusiastic by the fact that it could engage a wire in teeth that had so large malalignments. And this colleague was very happy to see this condition and see that after some time, I don't know exactly, I mean, I have no idea of the time that passed between these two pictures, but he was very happy to see that we have an alignment. But this is not what we would like to get. And I would like you to remark, I would like you to remark that in spite of the fact that you have a better alignment, here we have a dip bite, and here we have the same dip bite. So what happened? Actually, what happened is an extrusion of this tooth here, and not an intrusion of this tooth here. So we don't know exactly what was the goal of this treatment. I don't even know if the doctor had really an idea of what he wanted to do. But personally, if I see a patient like this and I find myself with this curve of the occlusal plane, I would like to have it corrected by intrusion of this incisor most of the time. And this kind of correction is not real correction, but now if we want to open again the bite, we will need to re-intrude this lateral. So actually we didn't do a step forward, but we did a step backwards. So what happened here is that if you look at this geometries here, I can imagine that this lateral has to be extruded and requires a moment like this, while this central has to be intruded and has the same moment. Now, this is what you have learned now, and this is the force system that is generated when the wire is engaged inside the slots. But what is happening in the reality? What I see is that I see the extrusion of this tooth, but I can't see any real intrusion of the central incisor. Look here, the amount of tooth which is displayed here is definitely not very different. Why did this happen? Now we have to think also about biology. And there is a very important thing that you have to consider, that the movement of extrusion is usually very fast if there is no occlusal force to counteract it. So if I apply an extrusive force to this premolar, probably nothing will happen unless the force is very high, or if I leave the force for a long time and there is the possibility of this tooth to move also in other direction. But if I apply the same force on this tooth where there is no occlusal resistance, this movement will be very fast. Why is this? Because the root, it's only kept in its vertical position by these periodontal fibers, and you don't need any bone rearrangement in order to move the tooth in this direction by extruding it. On the contrary, the intrusion movement that would be generated for this central incisor requires that we start resorption of the bone in this area, and it takes much more time. So what happens? That by the time that we start the movement, this lateral comes down very fast, and it doesn't leave the time for the central incisor to rearrange the bone, resorb the bone apically, and move the central as an intrusion movement. For this reason, once the lateral has extruded, the force is not there anymore, and so you don't get any intrusion. If you wanted to get an intrusion of this central incisor, you have to do something which is not including the lateral. So what would you need to do? Actually, and again, sorry, is to have a wire coming from this area where you have occlusal contact, not having brackets here, and engage the wire into the central incisor. In this way, all extrusive forces will be partly, the problem is that we have a lot of moments, and you will see that this is not an ideal thing. It's not really what I would do. But just to give you an idea that you might have some resistance from occlusion here, and in this case there's no possibility. So we see that using a continuous arch wire, we don't get exactly what we wanted. We have an alignment. Yes, I can say, oh yes, the teeth are better aligned, but they're not aligned where I would like them to be. So this is the concept of indiscriminate alignment. And so we can see a few of these examples of what we call inconsistency. I would like you to see this case where we have a sequence. All the teeth are inclined to the left in the lower arch. So we could imagine this position of the brackets. And if you place a straight wire here, actually you have all moments uprighting the teeth, but there will be vertical forces. And in the overall, you get extrusion of this side and intrusion of this side. This is here. You see, look at the lateral here. Actually, what happened, I mean, maybe my diagram is not correct. Maybe that the wire was going up here and was stopped here, was cut here. And you see that this lateral is extruded, and this distance here is larger than this one. So the bite is deep here and is opening here, you see? Again, these teeth are more aligned as individual relation between the brackets, but they are not where we would like them to be. Okay, so we can skip this. A very important concept that we should consider when we are discussing about statically indeterminate mechanics, it's that when we work with a continuous arch wire, the force system that we have at the beginning is going to change continuously. So what we have at the beginning is not what we will have during the movement of the tooth. And why is this? Let's have an example. And I have a two bracket system including this molar and this canine. And the canine is extruded here, and I place a wire here to level these two teeth. The result of this mechanics, it's very much depending on what I call a possibility of displacement. So there is a resistance to displacement of each of these teeth that can be very large or known, and if this tooth is blocked somehow by a TAD, by ankylosis, this is a maximum resistance to displacement. So let's assume that this molar here is not moving, so the molar is not moving, while the canine is free to move. So we will consider only the force system that are applied to the canine. And what is going to happen is an intrusion and a rotation in this direction because we were in geometry 1. So I see this kind of movement here. And now the angulation of the bracket is not anymore the same. So if I go on with this, I will cut here the molar. So just drawing. And so I'm in geometry 3. The moment to force ratio and the force and the moment are different, but the direction of the force and the moment are the same. So even if I'm not sure exactly what is going to happen, I'm going on with the same direction of intrusion and inclination to the distal. Until, if I see here, I got in geometry 4. In geometry 4, I hope you remember this, we have no force. We have no moment, sorry, and only a force. And therefore, we have no more the distal inclination of this tooth. Only some intrusion, like this, until the the geometry is transformed into a geometry 6. Now we have this V like this with the center in the middle, and the molar goes now uprighting in the opposite direction. Here we get in a stage where there is an undulation between geometry 4 and geometry 6 until we have a full alignment. But if you look at this, we have an S shape, and this is a condition where we have a jiggling. So in some part of the bone, we have some resorption first, and then apposition, and this is the opposite. Okay, so we have areas where there is a very fast change of message that is given to the cells, and this can be a very big danger for root resorption. It's very understandable that if I want to move this tooth in this direction, I would like to move it along a straight line and not with this S-shape path. Is there a solution to this? Of course there is. And just imagine that you use the same wire, and instead of engaging it, you ligate it outside. Now this moment is not here anymore, and you start the intrusion of this tooth without this inconsistency of the movement, which should not be S-shaped but should be straight. And this is an advantage by a biological point of view, and it's also an advantage for what concerns the speed of the treatment, because going along the straight line is also a shortest path. I want to now to give some more information about the limits and the problems that you can get once you are using a continuous arch wire and what we call indiscriminate alignment. I want you to see this for pictures that were published in a paper several years ago in the American Journal of Orthodontics. And this patient has been treated with the goal of having removed this first premolar. The canine should have gone at its place. So that's it. I would like you to remark that the occlusion here is very nicely established. So we have a very nice class 1 relation between the molars, and also the second premolars has a nice contact with the first molar. Actually, in cases like this, I'm very happy to what I get at the beginning of treatment. And in my way of seeing things, it's an asset I have at the beginning of the treatment that I should try to keep. So no reason to modify this occlusion in this case. So let's see what has happened. I mean, the guy has used a super elastic wire, and this is inserted between the molar and the canine. And considering that this wire has maybe it's not a NiTi 014, but it's a larger wire for sure, he has kept interbracket distance which is larger than usual, so it's about 15 millimeters or something, so that it reduces the load deflection of the system. But let's see what is happening. I mean, we are having a geometry between the molar here and the canine here. What kind of geometry do you think is this? It's not very far from a geometry 3. Okay? So in a geometry 3, what you get is a moment in this direction here, the same moment in this direction here, and forces. like this, and like this. Now, if this wire is acting on the molar with an intrusive force and with this moment, there is no way that occlusion can keep this position, because occlusion can interfere with movements of extrusion, can interfere quite well even with movement of translation. But a movement like this, where you have tip, mesial tip and intrusion, forget about it. Occlusion is not going to do anything. And so what is going to happen progressively is that you will have a tip of this tooth in this direction, so this kind of tip, and you will soon have a pre-contact here. Okay, so the tip will produce a pre-contact here. I would like also to say that due to the tip, we will have a push of this premolar that, as you see, here we have this thing that shouldn't be here. Let me see if I can take it out. Okay. Due to the mesial tip of the molar, the tooth is also pushing the second premolar. And look at what happened with just maybe a couple of months of treatment. What is happening is that the nice relation we had between the premolar and the molar here, so between the upper premolar and the lower molar, it was a very nice relation. Now it's gone. It's not there anymore. This is due to a couple of facts. One is that we have a push of the molar, pushing the premolar mesial, but even more important, we have a posterior rotation of the mandible because of the pre-contact. So we have a rotation of the mandible. And this goes on. You see that the bite is opening here so much. There's no bracket on the sacrum premolars. So what do you think we have this bite opening? It's just because the mandible is rotating to the distal. And more we have this pre-contact here, and we have now a class 2 relation. It was a class 1 relation, and I would say that from A to C here we have had a lot of step backwards, not forwards. Now I find myself in a posterior occlusion which is definitely more complicated than it was at the beginning. If at the beginning I could have think, okay, let's extract this tooth and do something, maybe an elastic here in this direction if you want to do it, besides the fact that probably this canine could erupt spontaneously, but we could use an elastic there. Now we have a totally spoiled occlusion and something that has to be totally recovered. We have a class 2. There is another thing which is not as bad, but still I don't like it. The inclination of this canine that you see from here, from here to here to here to here, becomes more and more vertical. I would have preferred to keep it more or less with this inclination, while here it becomes more vertical. Why is this? It is hard to predict it, but as you see here we have two geometries. The geometries on this side gives a moment like this. The geometries on this side gives a moment in this direction. And it's hard to say which is the largest. So we will see during the treatment, and we see that this canine has become more vertical, thus meaning that this moment was bigger than the other one. So at this level, from C to D, something has improved. You can see that now the second premolar, that are our reference because they are without brackets, so we are understanding that very little was happening. You see that the bite is closing again, and it goes a little better also according to the sigil for what concerns the sigil relation. What is happening here? It's just happening that this guy has found the right patient. I mean, the patient chewing here is reintruding this area and is overcoming the pre-contact, and now the mandible is going to rotate back forward, and this gets better. Nevertheless, we have not achieved the same nice occlusion that we had here. So this is a very good example for me to explain why a continuous arch wire has so many limits. So we start this last part of the presentation, and I would like to give you some practical rules in order to produce some rational alignment by moving only the teeth that you want. The rules you should consider, I will just open an empty screen just to write down a little bit, are very simple. Number one is that never align with continuous arch wire without thinking. You cannot simply, every time you see teeth that are not aligned, open your drawers, take out a plastic bag with your O12 NiTi and do every times the same thing. You cannot do it. What I can tell you is that you have to think a little bit, you have to be trained to think, and not do every time the same things. Okay, just because you're used to that, because they have told you to do that. We have to use our mind to do the right thing. So never align with continuous arch wire without having given some thoughts to this idea. Okay, you have to be open-minded. I'm not saying you will not use that, but always remember that when you have a large discrepancy, and so you have to do something like that, it will be always difficult to predict what is going to happen. In my personal behavior, I would never use an alignment wire here, but I do understand that other doctors are more prone to use it. So let's say that I use a straight wire without thinking sometimes, but only for very minor alignment. When there is a malalignment which is more important, I'm not going to do it. So I'm using a continuous arch wire only for finishing. And this means also that I'm not using very much NiTi wire like O12 or O14 because this is not so good for finishing. Okay, I most of the time use a continuous arch wire using beta titanium 1622 or 1725. But this can be very personal. So, and very general. So the next rule that I would like to give you, it's to consider that low geometries lead to inconsistencies and there is higher rigidity and it's easier to get a jiggling movement. Remember when I was telling you, and we have seen this canine that instead of going in this direction was doing something like that. So for this reason, unless the amount of malalignment is very, very small, I try to avoid low geometries. Now, the thing is that if you want to avoid low geometries, you can't use a full arch because, as we have seen, in a full arch there is plenty of low geometries. And by low geometries, I consider geometry 3 and below, and especially 1 and 2. But let's consider the good geometries, so the high geometries from 4 to 6. Now, how can we, you have seen this already, but how can we work in order to avoid low geometries? Let's imagine we have this condition. And here we have a low geometry here. This could be a geometry 1. And here's another geometry 1. Here's a high geometry. And here is a high geometry. For those who are, maybe many of you have heard about geometries for the first time now, but every one of you that has tried to align these teeth know very well that it's very difficult to engage the wire here, and that this rotation of this 2 incisor here is very, very difficult. But actually, think about this. The only and the main thing to be adjusted in this condition is just the rotation of this 2 incisor. So if we are able to rotate this 2 incisor in the right way, the teeth are almost aligned. So what can we do in order to avoid this low geometry in this area, in this case? One thing is very, very simple. Very simple. You take a cutter and you cut the Y here. So if you are cutting the wire in this point, the geometry between these 2 teeth doesn't exist anymore, of course. And what you will get is just the rotation of this incisor due to the high geometry from this area. So in this way, if you have a wire that goes from here to here, you will have the rotation of the central incisor and of the canine, and you might even not have a bracket here and let the wire work between the central and the canine. And so this will lead your central incisor in this position, which is fine. Well, you can do several things. You can decide that first you start rotating this incisor. Won't take very much, maybe 1 or 2 months, and this is okay. But what happens once that this central incisor is uprighted? Look at this. If this bracket is oriented like this is a high geometry. So now we can make another wire which will go on rotating this. This is one possibility. So first you rotate this one, and when this is corrected, you go on to rotate the other one. But maybe it's a better idea to find a way to fix the problem between these two brackets and have the rotation here. But you cannot use just a piece of wire like a straight piece of wire, because the rigidity here would be very, very high, and your risk of having a movement which is not straight but like this is also very high. So in these cases, we have to use something else that we will see in another lecture in details. But what we need to work with when we are working with low geometry is the rectangular loop or box loop. So in this case, I would definitely use a straight piece of wire in this area and a rectangular loop in this area. This would lead to the rotation of these two teeth. One other thing that we should stress: since you are working in this condition with high geometry, you can work also with wires that allow for control of the third dimension. So I'm usually doing this with beta titanium, so TMA, most of the time 16 by 22 or 17 by 25. And it's important that, probably we don't have the time to do this today, but you can bend this wire and you will learn that it's possible to modify the geometries so that you get exactly the movement that you need. But for now, let's imagine that you are not thinking very much and you are preparing a wire like this, which is more or less corresponding to your ideal shape, and you let it work in high geometries. And also this wire with this shape, that actually you would see something like this from the outside, is usually done with beta titanium 17 by 25. And this activation will show you that the system is not rigid at all. Okay? I'm using this concept very often. Another thing that it's important, that usually in these areas you have a lack of space, and that's another factor contributing to the difficulty of correcting these rotations here. And if you have no space, even if you apply the right force system to the teeth, they will be stuck there. So what do? We have to increase the space. So either you make an interproximal reduction to get the space, but rather than doing this, most of the time you can simply increase the space, and this is very easy if you have divided the arch in two parts. So actually you understand very well that here you have two grips, 1 and 2. And if you are using cantilevers coming from the molar, and this cantilever are applied at the same time on the two grips, lots of space is opening here. So sometimes what I'm doing is just to use this two segments. Usually one is for the high geometry and the other one for the low geometry with the loop. And if I need some space, I also use two cantilevers to create space between the two groups. Now I'm going to show you other possibilities. And you see this case where we have low geometries here and high geometries here, low geometries here. So instead of having a continuous segment, I'm taking advantages of the geometries existing, but not between adjacent brackets, but we have a high geometry between the two laterals. And there is a high geometry between the two centrals. So we have two separate wires. One is here and one is here to fix the whole thing. Give a look here. Here we have a high geometry, and here there would be a low geometry. Maybe it's a 3 or just below 3. Don't use a straight piece of wire here, but just cut it here. This would be the force systems that are generated by the straight thing. And that's the effect in a very, very short time. This could have been a couple of appointments. Only once that this premolar has been rotated quite enough, I can use a segment included in the first premolar. At the same time, these 4 teeth have been aligned. Okay, I don't want to work here for the low geometry. This would be inconsistent. Will be very rigid. And you solve this just by cutting the wire. All problems are depending on the geometry that exists between 15 and 14. So I don't want to have it there. Just cut the wire. So that's what we have seen here. And I'm not going to re-explain what happened. These conditions for alignment is always there. So if you have a wire like this, you have full of class 2 of low geometries. What can you do sometimes when you have a condition like this one? Like you see here, you have a tube. In a condition like this one, and if you use beta titanium rather than Ni-Ti, you can start bending the wire and making it passive. If you make a passive wire, all this geometry don't work. So let's assume that you have this sequence. And you are interested mainly in correcting the position of this bracket and bringing it here. What I would recommend is that you start bending a wire like this so that there is no activation in this area, and then you have a wire here. So the wire here, if it's straight, is going to give you a high geometry. So this will work. Same applies. If you need to work with the box loop or rectangular loop, if you have this, you may have a wire which is passive here, and then you make your rectangular loop for delivering this force. So the advantage of thinking in this way is that you can really focus on the tooth you want to move and apply the right force system, apply the right wire, and trying to solidarize together the group of teeth that, at least at the beginning or forever, you don't want to move. Okay? Okay, in this last minutes of this presentation, I'm going to show you a couple of conditions where this idea of using the right geometries is used. And we call this alignment by terminal end activation. So what does it mean? Here we have a condition where we have these 3 teeth that don't need any movement. So in this case, what I would recommend is that you are careful not to move them. So you need to bend the wire, which is passive here. Okay? If it's not passive normally, because there is a little bit of activation, just make it passive. And now you have at the end of the wire, so this is the terminal part of the wire, you will have the activation. And this is okay because it's a high geometry. So the wire will do like this, and progressively it will go through a dynamic of geometries from 6 to 4 to 6 to 4, so that progressively will extrude and rotate the canine in this way. So we call this terminal end activation, and we need to have a high geometry to work with this. This here is a very, very old case, and I believe that it's the first time I have applied this concept, and I was really pleased to see this result in this case. So again, this is very similar to the drawing I've shown you before. What you have here, it's a high geometry. What you have here is a low geometry. What you have here is a low geometry. And in this area, you might have a lack of space sometimes. But anyway, we have a wire coming from this side, which is activated here, so that we obtain the rotation of this lateral. And we have a rectangular wire, a rectangular loop here, which will get the rotation of the lateral incisor. It was the first time I was deciding to work in this way. This wire is, you see, it's a rectangular wire, it's 1725 on both sides. For some strange reason, the patient came back just 20 days later. I usually don't see patients so soon, but this happened. And it was amazing for me, really amazing, to see that this teeth had rotated so much and so most of the malalignment is gone. This is just in 20 days. One remark about times. If you have the right force system, the teeth are going to move in that direction if they have space. But no one can guarantee the speed. The speed, it's also determined by a biological response. So you need both the right force system, and then the speed will depend also on the biological reaction. But anyway, in this case was really very, very fast. And just 20 more days later, so it's not more than 1 month and a half, I am in this condition. So what happened is that the real problem which was in this area now is being corrected, and the only thing that you don't like is this little bit of rotation here. This little bit of rotation was here at the beginning. I want you to see this, but you were not remarking it because of the larger problem what we had here. So here we have a lot of problems and malalignment, and you don't care very much about this. Once these are fixed, you say, oh, this is not nice. But you see how this system is really working properly? And here is another condition where we work with high geometries. So you see here especially between these two teeth here, we have a very low geometry. What we would like to get is this moment and maybe a little bit of this movement. So we can do this with the wire coming from here, which doesn't make any movement here. So you have to make it passive, or in this case it's different because these teeth are blocked with Trigel. But anyway, we have terminal activation in this part. So the wire is maybe passive like that and is activated like that. High geometry, terminal. So the wire is cut here. And the same thing is happening here. So you get the rotation and this out. So well, another thing that it would be necessary in this case, but I didn't do it at that time, was that these teeth require this kind of movement. This will increase the space here, and definitely this lateral is more lingual than this one. And you could do this with another cantilever coming from this area and pushing like this, but this is another story. Here is another condition again, where we have a high geometry. You see this V position. And we have the low geometry here, but here we don't have any Y connecting these two brackets. So we just have a Y between the 6 and the 5. And I let this straighten up, upright, and align the second premolar to the molar. Then there is another arch which is working to correct the deep bite and upright the molars. But what I'm interested in now is this Y here. Working at terminal end, because this is the last bracket on the line, only with high geometries. Here is a case similar to what we have seen in the other case, maybe even more, but here we have a low geometry. Here we have a low geometry. Here we have a high geometry between these two. We have a high geometry between these two laterals. So we have two Ys, one between the centrals, maybe I should change the color. One wire is here, and then I have another wire which goes from the lateral to the lateral. The story is that I have a very efficient system to provide moments to all the teeth. There are also expansion forces that you can give by activating this arch. And also consider that friction here is very useful because we'll expand the space between the teeth. This is 2 months later. And maybe this is a level where you can decide, okay, I will use a straight wire. Okay. So I think that for today it's more or less what I wanted to tell you. I know very well that this is a very complex lecture, that there are a lot of information here, so it would be a good thing for you maybe to listen it twice. And there is more to say about geometries, but in just 2 hours I just went on through the most important thing. So I will give you a very short summary of what we have said. Number one, remember that statically indeterminate mechanics cannot be assessed completely, and the only thing you can do is to find out the direction of forces and moments in a 2-bracket system. If you work with several brackets in a full arch, things are definitely too complicated. Once you are able to understand the geometries and to understand which are the forces and moments that are generated, you can understand whether a wire is starting to move a tooth in the right direction or not. So you can understand whether there is an inconsistency in the force system. Besides this, remember that low geometries are not very much desirable in most of the cases because they have a very high rigidity, and the movement will change very much. A lot of time, if you work with the low geometry, you will have a rotation or an inclination in one direction that later on will be corrected. So it's a sort of jiggling that you have to avoid. Remember that if you want to avoid these low geometries, which usually is a real problem, you have the possibility of cutting the wire where a low geometry is and work mostly on high geometries. And how we will see another time, you can use loops as rectangular loops to correct these low geometries. This material that I have shown to you here, most of this material and even more, it's in our book, Biomechanics in Orthodontics, that we have published together with Professor Melson. This is chapter 7 for those who have it or want to get it. This is the indication to have it. For those who have not it yet, have not seen it yet, I would invite you to go there at this address, orthobiomechanics.com. as you see it here. But remember that the book is on sale, but the chapter 6, which is the one on statically determinate, so on cantilevers, the chapter on cantilevers is a free demo, so you can see this without paying anything. So that's it for today, and I apologize again for the problems we had yesterday, and I had to make this webinars recorded, and that's it. So have a good day and see you next time.